In the poorest countries of the world, where infectious diseases are prevalent, drug resistance is on the rise. Weak health systems cannot cope, and patients suffer as a result.
Drugs are so easily available in shops, over the counter. Anybody can buy them without a prescription. And if patients are advised by a doctor, by a friend, by some unqualified person perhaps, that a particular drug might be useful for their condition, they can just go and buy it. But what that friend or even doctor might not tell them is they actually need to take that drug for 6 months in the case of tuberculosis, maybe even 2 years if it's multi-drug resistant tuberculosis.
Patients are more likely to self-diagnose if they have an embarrassing condition, such as a sexually transmitted disease.
The first thing they talk about is ampicillin. So you sit the person down and find out why, and then you realize it's an STD.
Patients may also stop taking their drugs, particularly if side effects are unpleasant.
The first time I started taking Cipro, I feel very, very ache in my abdomen. So I complained and they told me it's one of the side effects of the Cipro. So I continued taking it. But sometimes when I start taking it, it's hard for me to even finish it.
Influencing patient behaviour is hard, but dispensers can help. In Ghana, informal drug sellers are trained to tackle drug-resistant malaria.
You know, chloroquine was a very good anti-malaria product, but now because of the resistance, we are facing it out.
They organize courses for us, train us on how to present the drugs and then how to dispose of the drugs, how to receive our clients.
Reaching out to dispensers through training, accreditation schemes and professional associations is vital.
The front line on addressing appropriate use of drugs and detecting when people are not responding well to the drugs that they're taking are the pharmacists and other drug dispensers.
Dispensers must be informed about proper drug use and the prevention and impact of drug resistance, as patients often go to them first for medicines and advice.
Member states, they sit in the board of the Global Fund. They sit in the board of UNITAID, and they can say, hold on. Don't just dump medicines in countries. Do something to strengthen health systems. Do something specifically to make sure that these medicines are used properly and do not create resistance.